Having cataracts does not always mean you need surgery. The severity of the cataract, the extent of vision impairment, the person's age, and whether their accommodation ability is still intact can all influence the decision. For instance, I had a 35-year-old male patient with cortical cataracts. This is a type of cataract that usually occurs in younger individuals. In this case, the cataract was not too severe. Considering that his corrected vision is excellent, and he is only 35 years old, which is still a very active age, and his lens is functioning well with good accommodation abilities, it would be premature and unnecessary to consider cataract surgery at this point. In this situation, the cataract grade is under C1 and the left eye is approximately C2, indicating an early stage cataract. The key factor to consider is how quickly it will advance. It is quite challenging to predict precisely how rapidly it will progress, so it is advisable to monitor its progression from the initial onset of the cataract. Fortunately, it did not appear to be progressing very quickly. And since your corrected vision was good and your prescription wasn't very high, we went ahead with Smart LASIK. Now if you look here, you can see some cloudiness on the right, left and center. Now if we zoom in, we can observe some cloudiness in the cortical region of the lens. This level of cloudiness might be noticeable to some extent, but it does not significantly affect vision. With Smart LASIK, it's hard to tell the difference. Even under a microscope, it looks the same. Therefore, after the procedure, the eye looked nearly identical to how it did before, and the cataract showed minimal progression. Now, there are these particular symptoms. When a cortical cataract is located in the middle of the lens, sunlight can cause more light scattering, making it easier to see in low light conditions. When it's very bright, like when looking at LED lights, you might notice more light scattering. This is something that can't be avoided. However, I believe it's not quite time for cataract surgery yet. It's important to try adjusting your vision first. When you cannot see well, you tend to strain your eyes. Do not we all squint when our vision is blurry? When you strain your eyes too much, it often leads to an excessively high prescription. To address this, we use a method called cycloplegic refraction test, which involves completely relaxing the eyes before determining the exact prescription. Thus, if there is a considerable discrepancy between your regular glasses and the refraction test results, utilizing mydriatics or cycloplegics to achieve an accurate refraction before the surgery can ensure that the lens power is precisely adjusted post-surgery. We corrected the vision to a much lower prescription. The visual acuity was excellent at 1.1. However, even in these cases, if you measure it with a machine after surgery, myopia often appears to be quite high. But with a thorough eye exam, you can determine that the prescription is accurate. Therefore, if you adjust the prescription for those who frequently strain their eyes, they might end up experiencing presbyopia much earlier. Sometimes individuals in their late 30s may begin to struggle with near vision. Therefore, in our next session, I will compile and present my surgical experiences with these over-accommodating patients. Now, if we take another look at cortical cataracts, as the name suggests, the cortex refers to the tissue near the lens capsule, and the central part is known as the nucleus. Instead of the nucleus, the surrounding part of the lens becomes cloudy, and this cloudiness usually appears as a white coloration. When the nucleus becomes hardened, it generally turns yellow, but if it turns white, especially in the center, the light will scatter significantly as it passes through. Thus, when scattering and internal reflection occur, the cortical cloudiness forms irregular refractive surfaces, causing light to spread in multiple directions. This can result in varied patterns of glare for different individuals. Some may experience severe glare at night, while others might face issues during the day if the cloudiness is concentrated in the center. This can cause day blindness, making it hard to see during the day. Additionally, at night, various types of light can scatter. In cases where the cataract is quite severe, cataract surgery would be the appropriate course of action. Nonetheless, for mild cataracts, like the patient we discussed today, cataract surgery isn't always necessary. You can achieve excellent results with just vision correction surgery, and even if cataracts develop in the future, whether it's 10, 20 years, or a few years later, undergoing cataract surgery at that time would mean using an artificial lens instead of your natural one. Unfortunately, the visual quality provided by this artificial lens will not match that of your healthy natural lens. So, considering the current situation, even if surgery might be needed again in the future, I believe opting for vision correction surgery is the wiser choice. The The surgery was highly successful. I have carefully assessed the patient's eye condition and chosen the most suitable method. I will ensure to perform it with precision and safety. Thank you.